So it begs the question, you're an expert in this area, but for a therapist who's not an expert in attachment, what would you suggest in terms of helping the therapist put on that lens? Like, how could we practice that in session? Like, what would be good kind of starting points as we're kind of getting our feet wet with attachment theory or intervention wise? What do you think a new therapist or even a seasoned therapist who hasn't really tried this hat on? Like, what might they do?
I mean, it really starts with, you have to really buy into the idea that
Mm-hmm.
attachment is the most important thing, and to look for it when you're doing, your initial assessments, your first meeting with the client, because a lot of times it is not possible, like with that client that I just talked about, the teen or adult clients whose parents have passed on or they no longer have a relationship with
Mm-hmm.
them. It's not always possible to repair those, attachments, but sometimes you're it,
Mm-hmm.
as the therapist. So the therapist's use of self and creating um, that safe relationship and helping them to trust
Mm-hmm.
and to feel held and nurtured and safe and supported. So sometimes it's, you know yeah, it's about that therapist use of self and the therapeutic relationship.
Mm-hmm.
So that starts from the very, very beginning, but you have to really buy into the fact that this is what the client needs, the most. And it's not like I don't do other things. I will draw from, cognitive behavioral. If I have a depressed, client, I will be
Mm-hmm.
encouraging them to walk, to socialize, to,
Mm-hmm.
to get out of bed, to be assertive, all those things. But it all is just by itself, without that relationship where they feel kind of unconditionally supported and that they
Mm-hmm.
have someone in their corner. It wouldn't be the same.
That
So
makes
so it
sense.
starts with, the beginning, the therapeutic, relationship. It starts in the assessment for looking for uh, what's going on in their attachments, early childhood attachments, and, in their marriage with their kids, what's going on, because you might start to see certain themes for problems that are all kind of created by that.